Medicare doesn't make any sense. So we're about to talk about a topic right now that we're going to try to keep as simple as 1, 2, 3. That's our goal here at Healthcare Solutions Direct. This might be a video that you need to watch a couple of times because this is a topic that we have to go over quite a bit with insurance sales agents so that they become a Medicare expert. So in order to become a Medicare expert, you might want to watch this a couple of times. So when it comes to someone that's looking to enroll into Medicare, there are only three enrollment periods that are available that can be used to get Medicare Part A and Part B. So let me repeat that again. There are only 3 Medicare enrollment periods that an individual will have in order to get their Medicare A and B. And that's the foundation of Medicare, so you must understand exactly the foundation. So the very first enrollment period is called IEP. It's called the initial enrollment period. A lot of people refer to it as the 7-month initial enrollment period. It's when someone's turning 65, and we'll go into that. The other enrollment period, number 2, is the special enrollment period, also known as an SEP. And then the last one, number 3, which you don't want to be a part of, which we'll talk about here in a little bit, is the general enrollment period, which is referred to as GEP. So again, to become an expert in Medicare, you must fully understand the 3 enrollment periods. It's really important to get very familiar with each one of these 3 enrollment periods for Medicare Part A and Part B, since this is the foundation of everything when it comes to this federal health insurance. So original Medicare will be the foundation. So again, make sure that you understand this very, very well because this is the foundation of the federal health insurance program. So without original Medicare, an individual cannot purchase a Medigap supplement plan or choose to go with the alternative Medicare Advantage plan. When you're looking to enroll into Medicare, here's something that you should be aware of. When an individual is eligible for Medicare and decides to enroll into Medicare Part A or Part B, the federal government will always set the effective date for the first of the month. So again, key thing to remember is Medicare will not start in the middle of the month, the end of the month. It will always start on the first day of the month. So Medicare will never assign an effective date for Medicare Part A or Part B coverage that does not fall on the very first day of the month. So your Medicare will always fall on the first day of the month. We're going to talk about right now the most popular enrollment period for Medicare Part A and Part B, which is called the Medicare 7-month initial enrollment period, IEP. So the first time eligibility for Medicare will typically be when an individual is turning 65 years old. This period is referred to as a 7-month initial enrollment period, IEP, that allows anyone to enroll into Medicare Part A and or Part B. See, if an individual has not been granted Medicare eligibility early because of a disability, this enrollment period will be extremely, extremely important, so please pay attention. During the initial enrollment period, the individual will not need to provide any documentation in order to enroll into Medicare Part A and or Part B. If the individual is turning 65 and has worked 10 years in the United States, it entitles them to their Medicare benefits. So most individuals should enroll during their IEP. See, this enrollment period is when everyone that's first eligible for Medicare Part A and or Part B should enroll, and here's why this enrollment period is so important, even to those that are still working and covered by employer group health insurance. There's 3 things about this enrollment period that are very important. The first thing is there's no paperwork that's required. Also, there's no delay to the Medicare Part A and Part B. And finally, the other big one is there's no penalty for delaying Part B during this enrollment period. So not enrolling during the IEP initial enrollment period can be very, very stressful. I've seen so many people in my career that have been very stressed out because they did not enroll during the IEP. So if an individual delays enrolling into their Medicare Part A and or Part B during the 7-month initial enrollment period IEP, they could find themselves with one of the 3 following situations. Number 1, they could have paperwork that's now required to enroll into Medicare, which can be very stressful. They could also find a delay in their Medicare effective date, which is another thing that can be very stressful. And lastly, they could be responsible for a lifetime penalty. So when someone is working with employer group coverage, here's our recommendation. You should still enroll into Medicare Part A and Part B. Many have differing opinions of this, and I'm going to explain to you why you should do it. See, many individuals that are still working and they're covered by their employer group plan may feel that delaying their Medicare Part B is a better idea because they have credible coverage. The first thing someone should do is look at the foundation of Medicare, which is that Part A is free. We've gone over that in a previous video. And Part B is $148.50 as of 2021. So original Medicare will cost an individual a total of $148.50 for the standard Part B premium in 2021. So here's why delaying Part B could be a very big financial mistake as well as a big headache for the individual later on. The first thing is paperwork will be needed from the employer, which could delay an individual from being able to actually enroll into Part A and or Part B. The second thing is that most individuals we've found that need to apply for Part B after their IEP, their initial enrollment period, need the coverage to start within 30 days. And that is typically not enough time to process that request with Social Security. So again, that's something we've seen that's been very stressful for most individuals that have delayed their Part B, is they found themselves needing the coverage later on within 30 days, and unfortunately it's not gotten taken care of in time for their request. The last thing is this: original Medicare with a Medigap supplement plan or enrolling into a Medicare Advantage plan could be a much more cost-effective way to go and better coverage than the employer group plan. We have lots of individuals that we talk to that delayed their Medicare A and B because they had employer group coverage, only to find out that they should have done it. It would have cost them less in monthly premium, and it would have also given them better coverage. So I'd recommend, if you have some of those questions, please reach out to us here at Healthcare Solutions Direct. We're here to help look at your situation, your particular situation, and point you in the right direction that's best for you.